Welcome to the Attention Deficit Disorder Expert Podcast Series by Attitude Magazine.
Hi, everyone. My name is Annie Rogers, and on behalf of the Attitude team, I'm pleased to welcome you to today's ADHD Experts presentation titled New Insights into and Treatments for Comorbid Depression. Leading today's presentation is Dr. Nelson Handal. Dr. Handal is the founder, chairman, and medical director for Dothan Behavioral Medicine Clinic and Harmonix Neuroscience Research. He has dedicated much of his career to developing and implementing technologies that elevate the quality of patient care. On the webinar today, we will cover treatment options for people diagnosed with ADHD and mood disorders like depression, DMDD, even bipolar disorder. We'll discuss the risk factors, the prevalence rates, and the often impairing symptoms of these comorbid conditions. We'd like to begin today's webinar by asking our live audience a poll question. Where is additional research and development most needed, in your opinion, in the realm of comorbid depression and ADHD? Please select your answers, and you can comment in the text box under the video player to tell us more. For answers to common questions about webinar slides, transcripts, certificates of attendance, just click on the FAQ tab of your webinar screen. If you're listening in replay or podcast mode, visit attitudemag.com and search podcast 456 to access the webinar resources. If you support the work we're doing here at Attitude to strengthen the ADHD community, we encourage you to visit attitudemag.com/subscribe and sign up for Attitude Magazine for yourself or to share with a teacher or a loved one who could benefit from greater ADHD understanding. Finally, the sponsor of today's webinar is Inflow. Inflow is the #1 app to help you manage your ADHD. Developed by leading clinicians, Inflow is a science-based self-help program based on the principles of cognitive behavioral therapy. Join Inflow today to better understand and manage your ADHD. Click the link on the screen to learn more. Attitude thanks our sponsors for supporting our webinars. Sponsorship has no influence on speaker selection or webinar content. So without any further ado, I'm so pleased to welcome Dr. Nelson Handal. Dr. Handal, thank you so much for joining us today and for leading this really important discussion.
Thank you so much for inviting me, Anne, and also want to thank Carly from Attitude. You have been excellent. And also my sponsor was Chris Dandy, and she has been probably one of the most prominent promoters of education in ADHD. She has 6 books out, and she's in the ADHD Hall of Fame. So thank you. All right. This is a very, very important topic, very confusing to a lot of people. And so we will try to learn about comorbid depression and ADHD, but also comorbid bipolar disorder and some other conditions that are in the mood disorders realm, like mood dysregulation disorder and emotional dysregulation, which is really not a disorder. We will learn a little bit more closely about the symptoms of mood disorders and how they coexist with ADHD. We'll talk about alternative treatments for depression, medication, neurofeedback, and neuromodulation. I'm not going to go too much into neurofeedback and neuromodulation because of time, but I'm going to spend more time talking about transcranial magnetic stimulation and esketamine treatments. And then we will talk, we'll do sort of an update of what clinical trials are going on at the present time in terms of developing medications for depression and ADHD. And we'll talk about treatment strategies to help people with depression and mood disorders. So let me start with this real life case. This lady, young lady, came to me on the 16th of this month, and the main complaint was depression. And she said that she had depression since she was 8 years old, and she even tried to kill herself at that age. She had undiagnosed complex ADHD. Complex ADHD means you have at least 3 conditions comorbidly with the ADHD. And the type of ADHD that we identified was inattentive type. And she had that since childhood. But again, it was untreated. But then we uncovered that she had history of being bullied and raped, and she has symptoms of PTSD related to that. In addition, she has social phobia, generalized anxiety disorder, insomnia, and family history of bipolar disorder and depression. So you can ask me, so how did you find out all of that? What we did which is what we do on every case, is we use a tool that we developed for the past 10, 12 years called Clinicom. So with Clinicom, the Clinicom is a tool that helps you identify more conditions that may be comorbid with the presenting complaint. In other words, if you go to any doctor, or most doctors, you say you're depressed, they will take a little form or questionnaire called PHQ-9, which is kind of sensitive, and specific, but only 88% specificity and sensitivity. But then if you meet criteria on that, then they will prescribe you a medicine, right? And it's over. We don't do that. We use Clinicom, which the patients complete Clinicom before they come to the clinic. And our clinic is extremely busy. We see about 200 patients a day. And so we have done thousands of Clinicoms, and we have refined it over and over and over. Okay, let's move on. There is a significant problem with depression and anxiety in adolescents. The problem is getting worse and worse over time. I have been almost 30 years doing this type of work. I'm a board-certified child and adolescent psychiatrist. And I see more and more patients suffering from adolescent patients, also adults and children. But here, this study is old. It's from 2015. And you can see that ADHD and depression is, the risk is higher than it has been. And don't forget that the iPhone started in 2012. Okay, we will talk about that in a second. And girls definitely have greater risk for anxiety and ADHD compared to their male counterparts. All right, so if you want to look at a study in adults of comorbid depression, you get something like this, what you have in there on the screen. And what is interesting about this slide is that I looked like I don't have very good vision, but still I couldn't find ADHD as a comorbid condition in adults who have measured depression on this important article. So the depression in adults, when you look for in the literature for comorbidity of depression in adults, this article reviewed first. They reviewed over close to 7,000 articles, and they included almost 200 articles. But those are the conditions, the medical conditions or physical conditions, if you want, that they found comorbid with depression. When we look at children, so this is a huge review of comorbidity of children with ADHD. And you can see that 67% of kids will have at least one comorbid condition. And then what we call complex ADHD, that's 18% that have 3 or more comorbid conditions. So if anybody has ADHD and is a kid, very likely that they will have something else with it. In children, and this is another very, very large review or study of with an N of 61,000 children, they found here depression as being a very important comorbid condition of ADHD, as you can see there. So mood disorders in general, what we call mood disorders is really the major depression, bipolar disorder, and there are different kinds of bipolar disorder, mood dysregulation disorder, and so dysthymic disorder, and other disorders like seasonal affective disorder. So all that are mood disorders, and between 10 to 30% of children who have ADHD may have a mood disorder. Okay, this is in adults, and you can see that mood disorders are the second most frequent comorbid condition for ADHD. And this is a recent article. We did our own investigation here. I have several times I have medical students from the local medical school. So we reviewed the literature and we put together this slide that, the comorbidity with ADHD is absolutely consistent with major depression. You can see that. Also with bipolar disorder. And we compared children and adults. You can see there. Substance use disorder, anxiety and substance use disorder, ODD, conduct disorder, school problems. So the depression or mood disorders, depression and bipolar disorder are very significantly comorbid with ADHD. You don't need to learn this at all. I just put this so that you understand. There's only one brain, and these things can happen in similar areas of the brain at the same time. Okay, so if you have ADHD, and a mood disorder, there must be something going on in several areas of your brain, and then there may be similar areas where these events are occurring. In the U.S., we have a high prevalence of ADHD, and you can see there. In the South, particularly, ADHD is really much more pronounced for whatever reason. Actually, there is a map of the South with, you can see it on the CDC website, and it shows clearly how we have a higher prevalence of ADHD in the South. Okay, so, people ask why people who have ADHD may develop depression, or what causes depression, anxiety in people who have ADHD. And this is one of the most important things I want to communicate to you. And that is that if you have ADHD, especially if it's not diagnosed or not treated, diagnosed and not treated, or poorly treated, you will have school problems if you're a kid, work problems if you're an adult, relationship problems if you're married or if you're in a relationship of any kind. And then many times you will have problems with rules, ethics, law. And people who have ADHD, for instance, have more traffic accidents and more speeding tickets than any other psychiatric condition. And then because of all these things that happen, and this is not the whole picture, these problems are not just the whole picture, but you develop, obviously, a poor self-esteem, you have poor impulse control, you may interrupt people a lot, that makes you feel bad. Then you have emotional stability compromised because things happen to you all the time if you have ADHD, at work, with your wife, with your children. Moms that cannot manage their children because they are working, they have to deal with the husband, they have to deal with 2 or 3 children. It's just not good at all. And then obviously your emotions will be impacted at some point. You have difficulty planning and executing. So all that makes it difficult for people to function. So I put these slides here, and you have to understand ADHD does really not happen in a vacuum, So untreated ADHD will make the patients feel really severely inadequate. I think also, if they are very smart, if patients have even higher IQ and have ADHD, and ADHD has not been treated, then they will not feel good. I can tell you story after story of patients who have ADHD, never thought that they could accomplish anything, and we treat them and they go to medical school. One of them came after finishing her residency and said, you remember me? And that was 10 years ago that I had seen her when she had finished high school. She goes, I'm a doctor and I'm an anesthesiologist, and thank you for treating me. And, that means the world to me. So if they're very smart and they cannot achieve their goals, and they don't know even that they have ADHD, they don't think they're good enough. They think of themselves as a failure. They think they're dumb, especially children, that they didn't work hard enough. And then because of these thoughts that they have or these experiences, then definitely they will feel worthless, angry, sensitive, reactive. That's why they may have this emotional response to failure, especially if they don't know they have ADHD. They may be reactive, and obviously, eventually they will develop depression and anxiety. In children, depression is not easily identified by parents. Actually, more parents probably don't know that the kid is depressed until something very obvious happens. So I put this slide together to make that clear. Parents don't know what's happening with a kid because a kid may be not sad, they may be irritable, okay? And then many times they hide their emotions. They don't talk about them. So take this into consideration. All right. So I have been lately very interested in epigenetics. So it's the interaction between the environment and us and people. It's some genetic changes that occur, but these changes are reversible. Okay. So when we talk about ADHD, I wonder what happens with these hostile environments that these children are operating in, and how do they deal with being rejected by peers, by teachers? I had a really bad case yesterday of a teacher devaluing this poor kid who's 8 years old. And so this is not something that we had too much evidence about in terms of how it impacts ADHD, but I think this needs to be researched more. So it's just not the demoralization that occurs with these patients, but actually it can get into real depression, being clinically depressed. All right. So why are female patients who have ADHD 2.5 times higher, at a higher risk for major depression? And I think it's because women are diagnosed later. And why? It's because the women don't have so much hyperactivity or impulsivity, or girls don't have that. So, they're undiagnosed, and so they are diagnosed later. And many times what we see is they are diagnosed in college. So the duration of the symptoms may be longer, and the rates of suicidality are higher. Think about it. So some 18-year-old goes to college, has ADHD, is smart, and now she has to deal with ADHD, she doesn't know she has it. She has to, do all these life skills, cook, pay bills, all these things that they have to do that they didn't do at home, and now they have to do it. And so they become extremely overwhelmed. And we are not even talking about social media right now, but you have to add that. So higher rates of suicidality in female patients who have depression, ADHD. So ADHD in older adults is not only associated with depression, but, also is associated with anxiety at high rates, like 25%. Okay, so if a child has depression and ADHD, obviously the impairment is going to be escalating to the point of maybe not wanting to go to school, failing school, repeating a class. And so if you have depression, ADHD, compared to controls who only have ADHD, the impairment is higher. Now, we were talking about epigenetics, but adverse life events on adults who have depression and ADHD are extremely, extremely significant. 20 to 70% of patients with ADHD have major burdens. And this publication is from before the 2012, where the iPhone came out, and Tim Williams there, who I know, they're in Harvard. We don't talk enough about the importance of adverse life events in patients who have ADHD. These episodes are reported by 35 to 50% of adults who have ADHD. And so it's extremely important to identify depression in patients who come and may come just because they think they have ADHD, or they had ADHD as kids, they didn't take medicine because they didn't like it. They come back and they say, I have ADHD. Well, how about having depression as well? And this is valid also for patients who are older. You can see they're even up to 94 years old. I think the importance of this slide, we have to understand that comorbidity is a real thing, okay? So, and not only for depression, also for anxiety, also for other psychiatric conditions, as we saw with that case that I showed you earlier. And this study is showing the importance of recognizing worthlessness. So worthlessness, helplessness, and loneliness. Those are three things that can predict suicide. In this case, in this study, these were patients who had ADHD, they were adolescents, and definitely depression associated with worthlessness was directly related to suicide thoughts. All right, so what is depression? Obviously, it's a feeling of sadness. In children, it may be, and adolescents, it can be irritability. So every medical student knows this, mnemonic here. But what I want to point out that there are clear 4 out of 9 symptoms of depression that you can have with ADHD, and they're bold red there. You can see that. And so it's really important because a lot of patients think, okay, so I'm distracted and I can pay attention. So which one is what? Is it depression or is ADHD? We had actually for this talk some questions about that. The feelings of having difficulty paying attention is different than concentration problems. With inattention, you get the aroused level to pay attention, but you can't pay attention. You can't filter the information and process it. With concentration problems, you don't have the energy in depression to get to the cognitive point of being able to grasp information. It's different. And with anxiety, you have also concentration problems, but that is because you have several ideas, thoughts that are going coming in and out, and then you cannot concentrate on one issue. On ADHD, also, if you're hyper or you get agitated, things can be confused between that and depression. Okay, the interest, decreased interest, what we call anhedonia, and I think one of the questions that a participant asked was that, she was taking ADHD medicine, she was doing fine, then she gets depressed, takes Zoloft or sertraline, and then she lost interest. So medicines can cause loss of interest, but the point here is that people who have ADHD really can have significant lack of motivation. And in depression, you have lack of interest. It is a little different because lack of interest in depression is like you don't even have energy to think about what you want to do today. Lack of motivation with ADHD is like a frustrated person who has tried everything and now, they're going to do something else and replace what they were supposed to do at work or at school. I had a kid who his parents were very well-to-do here in Dothan, and he decided to be a professional turkey hunter because he had no motivation to go to college. The parents were totally distraught. But anyway, let's move on. And mania is part of bipolar disorder for people who probably don't understand this very well. So it's the reverse of having depression. And the symptoms of mania, are 7 over there. And you can see, I also highlighted the symptoms of ADHD that can be considered ADHD or associated with ADHD there. And the distractibility in mania is different than the ADHD, but it's more similar. It's very close to ADHD, but it's more like an increase activity of the brain. Is trying to look everywhere, very easily distracted by little things. In ADHD, it happens, but I don't think it gets to that level. Mania patients or patients who suffer from mania, they are impulsive, as the ADHD people are. They have flight of ideas, and ADHD people can be thinking about certain different things, and they have very busy brains, but you cannot recognize clear flight of ideas. You may see them, but it's not very clear. And mania, when patients have mania, they have significant talkativeness, pressure speech. So I put there the different kinds of bipolar disorders, but we don't need to get into that. But just understand it's not easy to diagnose patients with bipolar disorder. All right. So since we're talking about bipolar disorder, so children who have ADHD have 10 to 20% chance of developing bipolar disorder. Okay. And this work is just phenomenal, has been phenomenal. But all these people who are there, Joe Biederman and Steve Marron, etc., Janet Wozniak, this work has been monumental because, 20 years ago, we didn't know kids had bipolar disorder. And Janet Wozniak and Biederman, they started talking about it. I remember going to the American Academy of Child Psychiatry and saying, what? But also we didn't know, or we didn't pay attention to the fact back then when I was even training that adults could have ADHD. So I was never trained about how to recognize ADHD in adults. So we're making progress. All right. So hyperactive children don't have high risk of bipolar disorder if somebody is interested in, learn about that. Okay, so if a parent has bipolar disorder, then you have all these risks associated with developing other psychiatric conditions, mood disorders, 4 times higher, and 50% of comorbid psychiatric disorders, in addition to ADHD, mood disorders like depression. All right. So, if anybody has bipolar disorder, the risk of developing depression early is higher. Okay, so if I see a kid who is very, very depressed and they're like 8 or 9, the first question I have is, does the parent have any parent or close relative have bipolar disorder? So early depression, being very having difficulty with energy. These kids can be very unable to even go stand up and get a cup of a drink or something. Psychosis, early psychosis predicts more likely that they will develop bipolar disorder eventually. Like I said, family history of psychotic depression. I just saw a kid who is 10 years old. He's adopted, and the adoptive parent just told me that the kid's mother has bipolar disorder, and this kid was extremely difficult to treat, and we're treating him, and he's doing great, but now he's gaining weight, and a lot of people are familiar with why. All right, let's see. So, stimulants and antidepressants can induce mania. I have the case of a kid who's 18 years old, and his dad is a physician, gave him Zoloft, and then the kid developed bipolar disorder. Now he's on lithium. So this happens. So we have to be extremely careful about that. And this is one of my favorite authors, Bob Post. And the reason I'm bringing this up is because he's the first one. Look far in 1989, he started talking about how the initial episodes of a mood disorder can be influenced by psychological stressors. He's the first one who said that. Okay. The later episodes may not be, but if I have a bipolar patient, I tell them that they are not microwavable, and they completely understand that concept. So the stress is the worst enemy. So this study followed hyperactive children, thinking, okay, can they be more liable for developing bipolar disorder? And there was not significant risk for that. Okay, so bipolar disorder, if it starts in adulthood, only 20 to 25% of them will have ADHD. But if it develops in childhood, if bipolar disorder develops in childhood, look at that super high percentage, 80 to 97% will have ADHD, and I really don't know how to explain that. But the overlap is unidirectional. So it goes from bipolar to ADHD, but it doesn't go from ADHD to bipolar. All right. So now we'll talk very briefly about this disruptive mood dysregulation disorder and another disorder that has been talked about in the past 10 years. This is a new diagnosis for children, okay? Why people worried about DMDD, or why they felt the necessity to bring up this diagnosis, which is a DSM-5 diagnosis now. Because we had all these patients who were overly diagnosed with bipolar disorder, and that was the reason. So these children have severe temper tantrums. At least they have to have it twice weekly, persistent irritability for at least 12 or more months, and they have to be before age. The age has to be before age 10. But so This disorder cannot coexist with oppositional defiant disorder. If it was me, I would erase it from the DSM. Or intermittent explosive disorder, another disorder that people get diagnosed with when the clinicians really don't know exactly what's going on. And this disorder, DMDD, I put in the same category, okay? Lack of deep understanding of, mood disorders, I think, some cases may be consistent with DMDD, and I appreciate that, but I rarely diagnose kids with that. So we'll pass this too. And this is interesting because about 21.22% of 179 children with ADHD were diagnosed comorbid DMDD. But 89% of this group had ODD. You understand? And an anxiety disorder. So this is another condition. This is not a DSM or diagnostic or the Diagnostic and Statistic Manual for psychiatric conditions. People talk about, you have ADHD, you have emotional dysregulation that includes, mood instability, irritability, etc. You can see that, and I'm running a little late. So I'm going to move on. We will move, let's see. This article I put in here because it's from 2023. And the Child and Adolescent Psychiatry, the Academy, they put a task force that worked for several years. And then it says, impairing emotional outbursts may respond to successful treatment of the primary disorder. Okay? Especially for kids who have ADHD. So in other words, you treat the ADHD successfully, this impairing emotional outbursts may get better. And I have plenty of cases where I show that. All right. We'll move a little faster. Okay. So treatment. The treatment considerations for treating depression and ADHD. One thing that we have to understand is major depression and bipolar disorder, by the way, are not linear. They go up and down in terms of the severity of the symptoms. ADHD is linear. It's always the same. So if somebody comes and says, hey, I have ADHD, I need a medicine, I confirm the diagnosis, before I give them a medicine again, I have to make sure that they were adhering to taking the medicine before. I have to understand if they have any stigma issues about being treated and why they were not treated before. Family history. What medications did they take before? What side effects did they have? And sometimes we do pharmacogenetic testing, meaning to understand how the medications are metabolized. Okay, I'm really running late. But I want to look into measurement-based care, and we can do that with Clinicum or with other tools. What comorbid conditions does this ADHD patient have? You cannot just give them any medication without knowing exactly what comorbid conditions they have. And I really encourage you to read this. Our Surgeon General, Vivek Murthy, he is focused on social media and mental health, okay? There are now warnings. You remember in 1960, some of you may remember, early 70s, late 60s, they did the warning with cigarettes, and they're doing the same thing. Dr. Murthy, he is focused on this problem of mental health in adolescents and children as an epidemic. And he calls it the epidemic of loneliness. I could talk to you about loneliness for another half hour, but we really don't have time. So it's a crisis. And so I encourage you to read, actually came out yesterday, the advisories that they published. All right, new treatments for ADHD. So Qelbree is new. It's a non-stimulant. It works a little faster than Strattera. These arrows signify that we did studies for the sponsors that are manufacturing these medications. We did here in our clinic. We have done over 200 studies, and most of them were for ADHD. So Qelbree is a really good medicine for patients who don't tolerate stimulants. Asteris is a medicine like Focalin, but it's a prodrug. So it has an amino acid linked to it. And, it's that amino acid is cleaved in your large intestine. Excellent medication also. Jornay is also new. This medication, you take it at night and it starts working in the morning. So for those kids who are very, very difficult to manage in the morning, Jornay is a good option. Excelstream is a new patch, but it's a dextroamphetamine patch. It's, I think, coming out this month. We only have a methylphenidate patch. So this good is an excellent addition for people who have difficulty with their GI system. All right, we did a study with this digital therapeutic, Akili. It's for age 8 to 12. So this is therapy with a tool, okay? And it works. It works, but it takes time. So in the pipeline, we're doing a study with centanafadine by Otsuka, which is a Japanese company. And this compound has dopamine reuptake inhibition, serotonin reuptake inhibition, norepinephrine reuptake inhibition. And it's showing that we enrolled close to 20 patients. And the company, the sponsor, is here checking our charts as we speak. Okay. This new compound also is in phase 3. We're not doing a study, but it's also dexmethylphenidate like Focalin. Man, I'm running late. Okay, these are all the medications for depression that everybody's probably familiar with. But I want to touch a little bit on new treatments, okay? A lot of people are familiar with ketamine. It's administered intravenously. But on the other hand, below there, we have Spravato, which is an S-ketamine, and you can do it nasally. Both are extremely effective. We will start, I think, studying Spravato in children and adolescents pretty soon. Vraylar is a phenomenal medication for bipolar disorder and also now for depression, because it's a really good modulator of at least four neurotransmitters, and dopamine and serotonin. But they call them partial agonists. So if it's too much, regulate down. If it's too little, regulate up. And Abilify does the same thing. But Vraylar is extremely effective for patients who have bipolar disorder or depression. I tried Uvality. The dextromethorphan part of it is an MDA antagonist for whoever is interested in that, with bupropion. I have used that, extremely effective. I didn't use psychedelics yet. This is a new antidepressant that's going to come out in August of 23. Also is, works on GABA receptors. It's a positive allosteric. That means on the enzyme, this medication will neuroactivate the GABA on a different site, not the receptor itself, for whoever wants to understand that. And this is a list of new antidepressants in general, and you can see there are several coming out. So don't be discouraged. I think the field is making huge advances. Okay, so the study is the largest antidepressant study that we have had in the US, okay? Thousands of patients, but only half of the patients really become symptom-free. And now we know that. And that's why transcranial magnetic stimulation is a really good option to treat patients who have failed one medicine or two medicines. And now the insurances are paying for it. So TMS, this is one of our machines. We have one here and one in Florida. Basically, there is an electromagnetic coil that is applied to the head, like you see there. And then these electromagnetic impulses are sent in a specific area of your brain, and you have to complete 36 treatments. And I would say in our clinic, it's not that 70% of the patients who fail antidepressants get better. I would say 80 to 85% get better. I saw one of them today. And this is the neuromodulation, and you can see with different devices. And I said, I mean, if you have TMS, why would you go this far? And neurofeedback, I think we need to learn more. We did a study of neurofeedback with and visualization with autistic patients. It has promises, but the platforms need to get better. Let's see. Okay. Well, in summary, we know now for sure ADHD is super comorbid with depression, bipolar disorder. There is a familial link. And the sadness is not just demoralization. It's worse in females. And the children who experience depression and ADHD have more impairment. And the severity of symptoms increase even to the point of suicidality when they are comorbid. It's important to differentiate bipolar disorder, major depression, DMDD, etc. The most important thing I can say is people need a very, very, very complete evaluation before being treated. I think that's all. And now I think we'll do questions. Man, I went over 10 minutes.
Don't worry. You covered so much, Dr. Handal. Thank you. And I encourage everyone who is listening or watching the replay to download these slides because they are just chock full of great citations, references, additional information that can guide you on this journey. And so before we launch into the Q&A, I will quickly thank Inflow once more for sponsoring today's webinar. And I wanted to turn also to the survey results because they do coincide with the questions we were receiving today. We asked, where do you feel additional research and development is most needed in the realm of comorbid depression and ADHD? The answers were very tight, but number one was managing treatment-resistant depression and or ADHD. Now, you talked a little bit about the transcranial magnetic stimulation and the neurofeedback. Are there other options for those patients who are finding they are not getting results with pharmacological treatment?
Definitely, the intranasal treatment with Spravato is. I have had even patients on TMS, medications, antidepressants, and Spravato all at the same time, and definitely works really, really well. If, for instance, a patient cannot tolerate TMS, the insurance doesn't pay, or the insurance will not pay for Spravato, occasionally we send patients for ECT. And ECT, the only issue with ECT, the main issue is efficacy is there, but sometimes they lose memory. So, yeah, there are options, and there are more options coming.
Yeah, it sounds like there's the pipeline is full, as they say. And I did want to mention that we have it on good authority that Zylstrom, the new ADHD medication, is reportedly available now, as of the last week or so. So,
That's a really good option.
Yeah. Okay. A related question. You gave an overview of both non-stimulant and stimulant medications. Is there any reason that someone with ADHD and comorbid depression would favor taking a non-stimulant over a stimulant?
I think the reasons can be because they took stimulants before and they were activated. For instance, if you have a mood disorder or they have cardiovascular problems, high blood pressure, for instance, or they have cardiomyopathies and their primary care doctors or cardiologists don't want them to take stimulants. Stigma about stimulants, stimulants have been around for 60 years and are the most studied medications in the pharmacopoeia period. So, but there's stigma about it. And I think the most rewarding thing about my job is when I see these little kids doing better in school or adults having a promotion because they are treated with stimulants.
Yes. Yeah. Important to note that they are quite studied. And along the similar lines, quite a few, especially parents of teenagers, concerned about black box warnings associated with SSRIs and whether that needs to be on their radar as they consider treatment for comorbid conditions.
Absolutely. Okay, so is it true that SSRIs can cause, emergent suicide thoughts? Absolutely. In adolescents, yes, absolutely. In children, it can happen. The same way that stimulants can cause hallucinations. I have seen it before. So side effects of these medications are important to consider when you're treating them. For instance, if I'm going to give an SSRI to somebody who has family history of bipolar disorder, a kid, let's say, depressed, and then I have to know from the family history if there is bipolar disorder, let's say the mother, the grandmother, or the father have it. You see, you have to look at every little detail before you give them an antidepressant. So it can happen. I have seen it happen, even in kids who reportedly didn't have family history of bipolar disorder, but absolutely can happen. And so there are two goals with treatment. One is efficacy and the other one is tolerance. And I tell every parent, those are our goals. So I said, but we will go low and slow because of tolerance and possible side effects, including suicide thoughts. So we see the kids like after 3 weeks, trying to make sure we ask them. We go on a very low dose first and go up slowly. And that way you prevent these problems to be minimized.
Okay, wonderful. I will turn back to the survey because coming in a very close second in terms of priorities were parsing out copycat symptoms. In other words, really honing in on a true diagnosis. And we've heard today from dozens and dozens of women in particular who were diagnosed with depression long before, in some cases decades before they were diagnosed with ADHD due to outdated stereotypes about ADHD. I don't know, don't expect you to solve this problem, but do you feel that the medical community is headed in the right direction in terms of identifying that ADHD does in fact occur in girls and women? And any advice for people out there listening who are feeling that their medical practitioners are not hearing them?
Yeah, absolutely. In general, I would say that that's true. But in addition, I want to say and mention that we are receiving at least twice or 3 times a week a referral of an adult ADHD that a primary care doctor identified them as possibly having it. And now people go on they go on online, and they want to diagnose and figure out what they have, and then, oh, maybe I have ADHD. And for that reason, primarily, us and many clinicians all over the country use Clinicom, because it can identify 80 psychiatric conditions, and then the kid can do it, the adolescent can do it, the parent can do it, and you match if the symptoms are real. Also, I want to mention quantitative electroencephalograms, because that is not like a continuous performance test where you have to click if you see a signal on a computer and they determine if you have attention problems or whatnot. But we do quantitative electroencephalogram when we doubt about the responses that we get or about the validity of the answers. And it's pretty sensitive. So we try to do whatever we can to make the right diagnosis in the correct way.
Okay. And that does piggyback on a number of people were wondering if the Clinicom assessment tool is publicly and widely available. Should they ask their clinicians about it?
It's widely available. You can go to clinicom.com and you can learn everything you want about it.
Wonderful. Okay. And, the third priority that came out in our survey is just closely aligned with that last one, and that is early detection, the importance of early detection. And that kind of dovetails with this idea, in some ways. You spoke a bit about the impact of adverse life events, and we had a number of people wondering if you could specify what falls under that umbrella.
Okay, it's really a wide number of things that can occur. For instance, the rates of divorce the rates of divorce and the suicide rates in adolescents went up since the 70s together. Both lines go up. So an adverse event can be divorce of the parents. An adverse event can be losing a parent. Adverse events, for instance, there are so many kids who lost their parents during COVID. COVID itself is an adverse event. It's anything that will alter your normal functioning. Okay, a teacher who becomes physically abusive with an ADHD student, or witnessing domestic violence at home, knowing that the parents are not available to take care of the kids because the parents are on drugs, losing a home, financial problems. I mean, we have on Clinicom 99 different stressors like that. Even Christmas can be a stressor, that. So it's important to realize that we cannot ignore our environment, or availability of healthy food. Many parents may have problems financially, and they don't get healthy food for their kids. Not playing outside, so I can tell you. I mean, there are too many to
right.
But
it probably is worth underscoring that coming out of the pandemic, many children, not to mention adults, have experienced, adverse life effects or life events. And I will just remind everyone that you had mentioned the Surgeon General's warning that just came out yesterday regarding the impact of social media on the developing brain, and the fact that the Surgeon General is calling for greater regulation around that. So a lot of impacts from both external and internal. Goodness. So we are just out of time. You covered so much, Dr. Handal. This was an incredibly informative, rich webinar. I know my notebook is full, and we received many questions. So I think we will almost certainly be doing more on this topic of treating comorbid ADHD, depression, bipolar disorder, and many of the others that you mentioned here today. But for now, we hope that everyone who joined us will join us again for another Attitude webinar. If you're listening in replay or podcast mode, visit attitudemag.com and search podcast 456 to access the webinar resources. If you support the work we're doing here at Attitude to strengthen the ADHD community, we encourage you to visit attitudemag.com/subscribe and sign up for Attitude Magazine for yourself or to share with a teacher or a loved one who could benefit from greater ADHD understanding. Dr. Handal, thank you again for this wonderful session, and we hope everyone just has a wonderful day.
For more Attitude podcasts and information on living well with attention deficit, visit attitudemag.com. That's ADDITUDEMAG.com.
Ever tried reading while jogging, cooking, or even juggling flaming torches? Yeah, it doesn't end well. But with audiobooks.com, you can conquer books without the circus act. Dive into over 450,000 titles, including more than 10,000 free ones. Get hooked on a bestseller, find your next obsession, or finally read that classic you've been avoiding since high school. And here's the inside scoop. Sign up today for a free 30-day trial and snag your first 3 audiobooks on the house. Sign up for your free trial at audiobooks.com/podcastfree today. That's audiobooks.com/podcastfree.